Thank you for joining me for another microbiology lecture. In this lecture, we're going to talk about chapter 11, which covers mycology. And mycology is the study of fun guys and fun gals. No, just fun guys. This lecture is going to compare and contrast different forms of fungal organisms, which include yeasts, mushrooms, and molds. So this is the study of fungi. And so we're going to talk about the different types. We're going to describe different routes of transmission for fungal diseases, discuss different species in the food industry, yum, and describe the infections in humans that are caused by yeast. So that is what is on the agenda for today. Now, the study of fungi, which is mycology, as I said, this group of organisms are macroorganisms. So they're multicellular creatures, and they have these complex eukaryotic cells. So scientists think there's probably millions of these fungi in the world, but they've only found about 100,000 of them, and about 400 of those are pathogenic to humans. Mushrooms, as we know, do really well in the dark, and they grow well there. And mushrooms are important staples in a lot of our diets. However, some of them can be fatal if you eat them, so don't just go around plucking and eating any mushroom that you see. You want to make sure that it's safe first and that you're not going to have some kind of strange trip if you eat one. But these guys don't have chlorophyll. So they don't have the ability to take light like plants do. So sometimes they get mistaken for plants, but they're really not plants. They're in a class all of their own. They don't have chlorophyll. They can't use it to make energy. They're also classified as heterotrophs. And because of that, they have some really amazing properties referred to as bioremediation properties. And that means that they can help us break down bad stuff in the soil, like contaminants. They can be used to break down contents of septic tanks and radioactive waste and even oil spills. So that's pretty awesome. Thank you, mushroom. Mycoses is the name that we use for a fungal disease, to refer to a fungal disease. They are classified according to the types of human tissue that they infect, but the good news is that most of these infections are superficial and they're not life-threatening. However, those individuals that are immunocompromised are again at the biggest risk. This is a common theme that we're seeing as we kind of continue our journey through microbiology. And so those that have HIV, those that that are undergoing cancer treatment, maybe they've had a transplant and they're on immunosuppressants, those kinds of things. The primary reservoirs for fungi are soil and animals. So how do they enter into their host? Well, typically by direct contact or by the host inhaling the spores, breathing them in, but they can also enter through a wound in the skin. One of the distinguishing characteristics of fungi is that sterols, a type of lipid, makes up the cell membrane of the wall of the fungus. And another distinguishing characteristic, like I mentioned before, is that they do not contain chlorophyll, unlike plants. Now, if they're in their unicellular form, they're going to be yeasts. And if they're in their multicellular form, they're going to be molds or mushrooms. And molds, they have these really long filaments, and they're called hyphae. So let's talk about how we get to hyphae. Hyphae, there's two different types, aseptate and septate. And septate are divided into sections or separate cells by these little walls or partitions called septa. You might be familiar with the term septum, like the partition that divides our nose into two halves inside. Now, hyphae that don't have septa are the aseptate types of hyphae, and they are not divided by these walls. They just have a bunch of little nuclei and fun little things just all floating around, but not divided into separate little compartments. Now, these hyphae, they branch out and they grow really long and they look really cool, like these fuzzy little extensions or projections. And we're going to look at a picture on the next slide. So when we talk about yeasts reproduce by a process called budding, and it's not a term that's unfamiliar to us, but yeast will make this little protuberance, this little bump that kind of grows out, and that is called a blastoconidium. And this is created by the parent cell. Some species of yeast produce buds that grow longer, and they look similar to hyphae, and these we refer to as pseudohyphae or false hyphae. Now, some of these fungi are shape shifters, and we refer to them as dimorphic. Dimorphic means that there's a few of them that either live as a mold or a yeast, and they can go back and forth depending on where they're growing. So when the fungi grow in tissue that's at body temperature, they're unicellular yeasts. But when they grow at room temperature, or when the specimens are taken from the soil or the dust, they're growing in their mold form. Okay, and they have hyphae and spores and the whole 9 yards. Some of those include histoplasma, blastomyces, coccoides, paracoccidioids, and candida. Here is a picture of a delicious piece of cake. What do you say? Do you guys want a bite of that strawberries and cream cake? No, it's really not cake. That is actually a fungus, the bleeding tooth fungus found in North America and Europe. It actually oozes red blood-looking substance, and it's said to have an anticoagulant property. So I thought that was pretty interesting. I would like to make a cake that looks like that. Here are some pictures because we all like pictures. They're worth 1,000 words. In the top left here, we have a picture of yeast budding. So you see these little round little buds, that's them. That's the blastoconidium. Bottom left, we're looking at the difference between septate hyphae and non-septate hyphae. So you can see the one on the left has these little partitions, these little walls that separate it into little compartments. That means it has septums or septa, right? And then on the other side of the same picture, we have the non-septate. So these do not have septa. They're just one solid area. And then here's some hyphae that we're looking at. Or not hyphae, I'm sorry, well, it is hyphae, but it grows into something called mycelium. And so here we're looking at the mycelium, which looks really soft and fuzzy. Fungi use two different types of reproductive methods, asexual and sexual. So we're going to talk about asexual reproduction first. A true spore is formed by either asexual cleavage or sexual meiosis. So there's two types of asexual spores, and those are sporangiospores and conidiospores. The sporangiospores are true spores, and they're formed by cleavage from a sporangium. And you can see this top right image. There is the sporangiospore, formed by cleavage. The sporangium, the little tree-like device, are the support branches that are formed by the hyphae. And sporangiospores are produced only by one class of fungi, and those are the zygomacetes. Now, the conidia are produced by most of the fungi, and these are not true spores because they are not formed by conjugation or cleavage. They're produced by the same fungus, but are of two types, either multicellular or unicellular. They're either produced directly from the hyphae, and you can see the conidospores down on the bottom right. They're produced directly from the hyphae, directly from yeast cells. This one kind of looks like one of those dandelions that you would find in a field, or by specialized cells called conidiophores. And then conidiophores, there's 4 different types of those, and there's 4 supporting structures for the conidiophores, and those are the annelids, the atheroconidia, the chlamydioconidia, and the phyllide. And these are each different types. You can see some are long and tapered, some are square, some are round, and some are short. And these are the support structures that allow for this asexual reproduction. And here are some images here for those visual folks that are listening and watching this lecture. Here we have the top left here is the atheroconidia. You can see the shape of that. Those are the square-like conidia. They definitely look square. And then here we can see the macro versus micro conidia, right? 2 different types, it said, that are produced. The multicellular ones and the unicellular ones. You can see them there. And then over here on the right, we have our blastoconidia and our chlamydiospores. You can see those there, how some look like little clusters, some look like little segments, and others look kind of like big round beads. Since most fungi reproduce asexually, sexual reproduction of fungi barely gets a shout out in our text, but it is there, and it tells us that when sexual reproduction does occur, this requires 2 different strains of fungus to mate to perform sexual reproduction, which is rarely seen and not very common. But when it does happen, there are 3 different types of spores that are produced, and they are listed here for you. The zygospore, the ascospore, and the basidiospore. And you can see what the images look like. For the zygospore is a fusion of haploid cells, haploid meaning half. Remember here, this is meiosis we're talking about, produces 1 zygospore. You can see it there. The ascospore is formed in a sac. You can see that little bubble there with 4 little divisions in it. And then the basidiospore is formed externally on a little pedestal. And you can see them growing there off from the pedestal. To classify fungi, we look at the type of spore that they produce. And here's just an example of some phylums, and we could just look at the top one, Zygomycota, and an example of that would be Rhizopus, and it produces, sexually, it produces a zygospore, so that would be one of the classification measures. Asexual reproduction, it forms a sort of sporangia, and it forms an aseptate hyphae. Right, so all of these characteristics we kind of look at, but they zoom in on the type of spore that's produced to really classify these guys. Let's talk about treatment. If one were to acquire a fungal infection, typically they are superficial infections that occur on the skin or in the nail beds, the sole of the feet. Could also occur as a vaginal yeast infection. And if this happens, then they can be treated with antifungal medications. If left go, they can become systemic, and this is a lot more risky situation because antifungal agents can become highly toxic to humans. And the reason is because the fungal cells, they're these complex eukaryotic cells, and so are we. So our cells and their cells are a lot alike. So it's difficult for us to treat these systemic infections because the drugs that affect the fungal infection also affect our cells as well. But they have developed some agents that are fairly effective. They're the class of drugs that end in azol, like fluconazole. And we still have to continue to monitor patients for toxicity, but this is also true with high dosages of antibiotics and those types of things. Now we're going to take a look at some different fungal infections, opportunistic ones, which means they really don't harm us, they don't bother us unless they're given an opportunity. And one of those big opportunities is a suppressed immune system. So if an individual has a suppressed immune system, like I've said before, then these fungi can become pathogenic to us. And we've talked about corticosteroid treatment before, how that lowers the immune system, as well as chemotherapy, HIV, diabetes, chronic antibiotic therapy is also another one. And so here is a picture of this little baby's mouth. And babies are highly susceptible to a fungus called Candida albicans. If you've heard of thrush, that's what you're looking at here. It's a fungal infection. And little babies, their immune systems aren't fully developed yet, so they're at a higher risk. Meet Aspergillus. Aspergillus is a fungus that causes aspergillosis, and there are several species of it. Three common ones that have been proven to be opportunistic species are A. flavus, A. fumigatus, and A. niger. And this picture at the top middle that you're looking at is A. flavus. It's this beautiful kind of green color. And on the left side, you're looking at down the throat, that's the larynx there. And you can see that there's some sort of infection going on there by Aspergillus. The far side, that is a lung that has been infected by Aspergillus. So let me tell you how crafty this little fungus is. This little fungus produces some conidiophores, and then they become airborne. And when they get airborne, they can be inhaled through the nose and they can go into the lungs and cause bronchial infections. If we have an immunocompromised individual, that can develop into pneumonia. It also is characterized by the destruction of lung tissue and necrosis, as you see here in this picture. It has an affinity for blood vessels, so it can get into the bloodstream, start to grow in there, and cause like this fungus fuzzball that obstructs the blood flow. And it can also culminate in the nasal passages, causing sinonasal infections. It has also been known to destroy nasal sinus bones and bone segments at the base of the cranium. Then it can bust into the brain and infect the brain. Also, if it gets into the circulatory system, it can travel to the brain that way as well. As many other organs like the liver, the heart, and the kidneys. These infections are very difficult to treat and they have a very high mortality rate. And when we have an individual that has had tuberculosis and they develop these tubercles in their lungs, it makes like these little cavities in their lungs. And that is the perfect place for Aspergillus to kind of get in there and settle down. And then it makes these gigantic fungus balls inside those tubercles. This fungus just blows my mind how resilient it is and how difficult it is to treat and how disastrous that it can be in the human body. Our next suspect is wanted for causing mucormycosis, and the most common one for causing this type of condition is Rhizopus arisus. And that is what you see going on here. You can see it growing on some delicious strawberries, and you can see it growing on this delicious face. And either way, it is not a good thing. Typically, again, these guys are inhaled, and so they're going to get into the respiratory tract and potentially into the GI tract first. So there's no vaccines for fungal infections. And so we treat them with antifungal medications the best that we can, but prevention is the best. Prevention means not going around dead and decaying stuff and stirring it up and breathing it in, because a lot of times that's where these guys live, right? Dark, wet, warm places where they can proliferate and grow, and then when they get stirred up, then it releases the spores and we can potentially breathe it in. All right, so this guy right here, this Rhizopus arisus, can cause pulmonary mucormycosis, so it can get into the lungs, it can get into the brain and cause rhinocerebral mucormycosis. Some symptoms might include swelling, fever, headaches, sinus congestion or pain, serosanguinous drainage or bloody drainage from the nose, drooping eyelids, black pus coming from the eyes, dislocated eyeballs, all kinds of good stuff, inflammation and pus and abscesses. That's what we're talking about here. Rarely does it infect the GI tract. Again, individuals that are at a higher risk for developing these types of aggressive fungal infections are those that are immunocompromised. Our next assailant is coccidioides. And coccidioides, two common ones are C. immitis and C. posatici. And these guys cause coccidiomycosis. And so you can see some beautiful blooms of the coccidioides up there at the top. And these fungi like the more dry, arid, desert type environment. So we do find them here in the United States, in Arizona, in California, in Mexico, Canada. They can be found as well. Now, they don't really cause a whole lot of terribleness. It's not very common for us to be infected with them, but they do live in the dirt. And here in Arizona, when we have those nice haboobs and there's lots of dirt, flying around. We don't want to be outside inhaling it. If most individuals, if they are infected with it, they don't even show any clinical signs. And if they do, it's very mild cases. With most of these fungal infections, direct contact transmission is really unlikely. So you can see this picture, bottom right, there are some lesions on that young man's skin there from coccidioides. However, it's not too harmful. Our next culprit is Histoplasma capsulatum, and it causes something called histoplasmosis, and it is most commonly found in the United States, and specifically in bat droppings, in guano. So that big pile that you see on the top image, that is our lovely bat guano. And on the right there, that is a beautiful bloom of Histoplasma capsulatum. And then you can also see a lesion on this gentleman's lip here of histoplasmosis. So this is typically found in caves. So just for you spelunkers out there, make sure that you, protect yourself and take precautions if you are going to go spelunking, or maybe, you're cleaning out the chicken coop this weekend, or helping to knock down that abandoned building, whatever the case may be. These are places that Histoplasma capsulatum lives. Cutaneous fungal infections are also caused by opportunistic pathogens, and modes of transmission of different types of cutaneous fungal infections include person-to-person contact, animal-to-human contact, and also contact with contaminated public environmental surfaces. Now, there are a few different types of nail and skin infections that the book talks about, and one is called onychomycosis, also known as tinea unguium, which is of the nail, right? Fungal infections of the fingernails and toenails, and this can cause them to become discolored or thickened and broken. Some things that we can do to reduce the chance of us getting some type of onychomycosis is keeping our nails clean and dry and short, not sharing nail clippers or nail cuticle nippers with anyone, not walking barefoot in public showers or locker rooms or dorm rooms or anything like that. Make sure that if you do go get a pedicure or a manicure, that they are properly sterilizing their equipment and cleaning out their tubs. Avoiding wearing artificial nails is also good, and not biting or chewing your nails and putting them in your mouth. Something else, dermatophytosis. This is fungal infections of the skin. There is a variety of types, about 40 different species, but some common ones are listed here for you, and they can commonly infect anatomical regions like the feet, the scalp, the groin, the inner thigh, the beard area, and face, hands, and extremities. So we're going to step away from talking about fun guys for a while, and we're going to spend some time talking about yeasts. Yeasts are unicellular creatures, and they reproduce asexually by the process I mentioned before, blastoconidia formation or fission. And you can see them making their little conidias right here in this picture. They have two classifications: ascomycetes or deuteromycetes. They're primarily transmitted by contact or through aerosol droplets. And so this means that the common portal of entry is the respiratory tract. Some yeasts are really helpful in the food industry, whether they are fermenting alcohol or helping us to make bread. There are other various things that yeast do in food as well. Some of them actually make up part of our normal microbiome. And those that we see infected with at most, again, those that are immunocompromised. Here we are looking at the beautiful Candida, and this particular Candida that we're looking at is the most common form, Candida albicans. And this is the yeast that typically causes thrush. And you can see the picture of oral thrush there. It causes these white plaques on the mouth and the tongue. It is not very common in adults. It is more common in little ones, less than a year old probably. Some other situations that it can cause, it can infect the skin and the nails. Of course, you see the mucosal infections of the mouth, esophagus, bronchi, and vagina as well as multiple organ systems, which is not very common to, and that is a form of invasive Candida or candidiasis. And those that are at highest risk for candidiasis are patients in ICU, premature or very low birth rate babies, post-operative patients, patients with central venous access lines, and HIV patients. So those that are going to be immunocompromised, again, are at a higher risk. And typically these are treated with antifungal medications, and in the instance of candidiasis, IV fungal medications for several weeks would be the treatment. Cryptococcus is caused by Cryptococcus. Cryptococcus is also referred to as European blastomycosis. And one of the more common ones is Cryptococcus neoformans. And that is a pleomorphic yeast. And one defining characteristic of this yeast that no other yeast does is that it produces a capsule. And this is part of the reason why it is more virulent than other yeasts. And so its portal of entry is the respiratory tract. So it is naturally going to result in a lung infection. It can spread to other organs or body parts, and it has a high affinity for the central nervous system. It can lead to meningitis, and it is responsible for the majority of fungal caused meningitis cases. And cryptococcal meningitis is the most frequent, again, occurring more frequently in our immunocompromised patients. So just as bacteria can develop antibiotic resistance, so can fungi. And a couple that we're really concerned about is a strain of Candida called Candida glabrata and also Aspergillus. Both of these species are developing resistance or have developed resistance to antifungal medications, those that end with that azole, like fluconazole. And you know, when there is a resistance of this sort, then they're trying to use multi-drug resistant antibiotics, and this becomes really expensive, and the more antifungal medications we throw at a patient, the higher the risk of compromising them due to toxemia. This is going to wrap up our discussion on mycology. I hope you thought it was interesting and insightful and frightening all at the same time. If so, then my job is done here.